During the simulation planning session, the radiation oncology team plans your treatment in minute detail. Arrive 15 minutes early, wear comfortable clothing, and plan to spend 1 to 2 hours at the facility. After you check in at the front desk, a radiation therapist will escort you to a simulation room. He or she will check your ID and take a photo for your electronic record. You will be situated on a table in the position that will be used for your radiation treatment. With some specialized treatments, body molds are used to help keep you in position. If you feel claustrophobic during the simulation or later treatments, let the therapist know so they can help you get more comfortable. Once you are in position, the therapists may make a small X with a permanent marker or give you a tattoo the size of a freckle to help them place you into correct position every day. More frequently, tattoos are done the first week of treatment. As another reference tool, they take photos of your final position. The radiation oncology team will use this information in planning a safe and effective cancer treatment.
Always remember that those that are treating you are looking out for your best. They wouldn't put you in a position they themselves wouldn't go through if they were in your circumstances.
Planning and validation, critically important parts of your treatment process, happen between your appointments at the Regional Cancer Center. The information from your simulation is given to a dosimetrist, a specialist in calculating appropriate dosages of ionizing radiation. The dosimetrist works with your radiation oncologist to formulate the best plan of treatment for you. Once it is checked and approved by the radiation oncologist, your plan is entered into your electronic chart. Before you return, your plan will also be evaluated and approved by a medical physicist, a specialist in radiation. The medical physicist often verifies the plan on the treatment machine. It may take the team a week or two to complete your plan. Once it is thoroughly validated, a representative will call you to schedule a verification appointment. Your radiation oncology plan is verified during a treatment setup day. Regardless of where you receive treatment, plan to arrive 15 minutes early. Remember to wear comfortable clothes for this important last step in the preparation process. When you arrive at the center, check yourself in at the scanner, take a seat, and wait to be called. Depending upon what part of your body is receiving radiation, you may be asked to wear a hospital gown. You'll be able to put your things in a locker for safekeeping. In the treatment room, the radiation therapists will ask you a few questions to verify your identity, usually your name and birth date. They will use the treatment plan in your electronic chart to explain your procedure and get you into position. Feel free to ask them any questions that you may have. The photos and marks from your simulation session are used to carefully adjust you and the equipment to match your simulation. Once you are in place, they will leave the room to take X-rays of your position. This is a practice run to check all of the treatment parameters. The equipment moves and makes a buzzing sound while taking X-rays. It may come close, but will not touch you. Try to relax and breathe normally. The therapists are observing nearby and can see and hear you throughout the process. They will compare your X-ray with the simulation image to make sure your radiation treatment will be accurate. At this point, the radiation plan has been simulated, validated by specialists, and verified in the treatment room. So treatment can proceed, usually the next day.
It was very easy. After the first one, it's the same thing every day. So you go in and it's the exact same treatment. The machine moves around you exactly the same as it did the day before.
Radiation is usually given daily, and appointments generally take 30 to 45 minutes, although only 15 to 30 minutes might be spent in the treatment room. Try to arrive 15 minutes early so you can get changed and be ready for treatment. To be safe, even if they just saw you yesterday, the radiation therapists will verify your identity by asking your name and date of birth. Treatment is much like verification. The therapists will carefully position you on the table. Although they leave the room during the procedure, they are nearby and able to see and hear you. You will be asked to breathe normally while the machine moves and buzzes as it administers radiation. You will not see or feel the radiation. At least once a week, the therapist will take X-rays. Since you are already in position, these only take a few minutes. As soon as treatment is complete, you are free to go. Throughout the process, the Cancer Center team performs a series of quality checks to help assure your safety. Your radiation oncologist reviews your x-rays to determine if any adjustments are necessary. The radiation oncology team discusses your treatment in a group meeting each week. Periodic peer reviews of patient treatment plans are also part of our continuous improvement process. Your radiation oncologist will meet with you once a week to discuss side effect management. Feel free to ask questions during this meeting or at any point throughout your treatment.
Anytime you have a question, they're always there to answer it. I think I went to the nurses' station at least once a week because I needed to ask the nurses for something or ask a question or ask if I should be feeling this. If the therapist didn't know, the nurses, always knew. And if they didn't know exactly what you needed, they would, speak to the doctors that were there.
People react to radiation therapy in different ways. Some people lose their appetites and shed some hair, while others need daily naps. Listen to your body and be patient with yourself. Eating well and getting plenty of rest will help your body heal.
Listen to your body. You know it better than the doctors. They're looking at scans and reports on paper, but they don't know how you're feeling, how you're dealing with things. So let them know if you're dealing with something that doesn't seem normal to you.
Your radiation oncologist, medical oncologist, and referring physician communicate to coordinate your follow-up care. When your therapy is complete, you will be given a follow-up appointment and discharge information. It is important to meet with your doctor and learn as much as you can about supporting your health in the days and weeks to come.
I feel great. I'm still getting chemo, so I'm still get a few side effects from that and get fatigue. But other than that, I'm on top of the world.